car parked outside, so we need to hurry up.
Good morning, class.
Good morning.
Let me just get this pulled up really fast. Alright, today we're going to have an oral pop quiz to see if you've reviewed the Inhalivent Respimat information booklet over the weekend. I promise this will be the easiest quiz ever. It'll be alright, guys. Does anyone know what Inhalivent Respimat is used to treat and some brief details about the disease state? Isa.
COPD, chronic obstructive pulmonary disease. It can last for years or be lifelong, but it can be managed.
Yes, it can be managed using Inhalivent Respimat. When you first get the inhaler, what is the first thing that you'll do?
Prime.
That's a great answer, guys, but what we're going to tell our patient is we're going to prepare the inhaler just so they get the correct dose each time. Can somebody please demonstrate how to prime the inhaler? Yes, ma'am, come forward.
The inhaler upright with the cap closed. Turn the base in the direction of the arrows on the label until it clicks, which is half a turn. Do this in one continuous movement to prevent small amounts of medicine from escaping. Flip the cap until it's fully open and point the inhaler toward the ground away from your face. Press the dose release button and you should see a spray of mist. If you do not see a mist, repeat these steps. If you do see a mist, repeat this process 3 more times. Close the cap.
Okay, that was great. Now, can somebody demonstrate how you would use the inhaler for daily use?
I can.
Yes, ma'am.
Begin by holding your Respimat inhaler upright with the cap closed. Then turn the clear base in the direction of the arrows in one continuous turn until you hear a click, which is half a turn. Now flip the cap until it snaps fully open. Breathe out slowly and fully, and before taking your next breath, bring the inhaler to your lips and close your lips around the mouthpiece without covering the air vents. The inhaler should be pointing to the back of your throat. As you take a slow, deep breath through your mouth, press the dose release button. Continue to breathe in slowly for as long as you can as the mist comes to you. Now hold your breath for 10 seconds or as long as comfortable. Close the cap and store until it's time for your next dose.
Great demonstration. And a good acronym to remember instructions for daily use is TALK. T, turn, O, open, P, press. Now, can anyone name a few common side effects that a patient may experience? Yes, ma'am.
Infection of the ears, nose, and throat, runny nose, cough, bronchitis, headache, and shortness of breath.
That is correct. And everybody received A's on their quiz today.
Yeah.
You should all now be able to properly counsel your patients on how to use Inhalivent Respimat. Class dismissed.